Most patients don't even realize that their symptoms are related to vein disease, and also primary care physicians don't.
Now a message from Sun Pharmaceuticals. For patients with locally advanced basal cell carcinoma who are not candidates for further surgery or radiation, hedgehog pathway inhibitors offer a targeted systemic approach. Staying current on these therapies can help you expand options for appropriate patients. Welcome to That's Derm Good. Today, my guest is Dr. Amanda Cooper. Dr. Cooper is a medical doctor and a vein specialist at ADVERTISER Veins and Vitality. Welcome, Dr. Cooper. Thank you for joining me.
You're welcome. It's good to be
Yes.
here.
Yes. So I'm curious. Okay, tell me a little bit about the name ADVERTISER Veins and Vitality. What is it that you guys do, and where did the name come from?
Well, we began as a vein treatment center, so treating varicose veins and spider veins. And then over time, we expanded to do aesthetics, so body sculpting and anti-aging treatments. And then we've added in wellness because all of these things seem to overlap and come under the same umbrella. So people looking for vein treatments also are interested in these other opportunities that we offer at the office. So acrobus is a Greek word that means precision and technique, attention to detail. Acrobus is a Greek word that means precision and technique, attention to detail, accurate and meticulous care. So that's pretty much our mission statement. And so we wanted to have the name be meaningful. And I think it's something interesting that people will be able to remember.
Yeah, I like that. When you said it, I was like, I wonder what the meaning behind that is. It's
Right.
always cool to hear the background. And, I think a lot of times when we are creating something or building a company, then you want to have some kind of meaning to the name. So
Right.
I love that.
Right. Thank
So
you.
tell me a little about your background. How did you become to specialize in veins, and why was that something that you decided you wanted to do?
Well, I was initially trained as a diagnostic radiologist. That was my residency. And during my residency, I was taught to use ultrasound for any kind of physical imaging. We used ultrasound for abdominal imaging and for visualizing blood vessels. And then I used that technique to access blood vessels. That is part of my training in interventional and vascular radiology. And so it's kind of something I was already doing, was using imaging to access blood vessels for the purpose of diagnosing diseases and treating diseases. And those types of procedures are much less invasive than surgery, so we can help patients with minimally invasive techniques. And then under that umbrella became the treatment of vein disease. And it just kind of was a transition over time. The benefit of treating vein disease is that it is so helpful for patients. So treatment of veins is under the umbrella of vascular and interventional radiology. I began treating veins in an outpatient setting, and I realized how much I can improve the quality of life for patients. Most patients don't even realize that their symptoms are related to vein disease, and also primary care physicians don't necessarily realize that a collection of symptoms could be related to venous insufficiency or chronic venous hypertension. And so I think part of what I'm trying to do is educate the population and educate other physicians, because these vein abnormalities can definitely be treated safely and effectively in an outpatient setting, and it does make a tremendous improvement in a patient's quality of life. So it's rewarding. It feels good to help people feel better and to make them happy after they've proceeded through the treatment plan.
Yeah. So when I think about, I guess, veins, my thought would automatically be, like varicose veins or spider veins, or
That's
just
right.
cosmetic side. I never actually thought about treating veins, because it can help with other conditions. What are some of the conditions that you commonly see?
Well, the most common symptoms are pain and swelling,
Mhm.
but there's also heaviness, fatigue, restless leg, which is an interesting symptom because most, at least patients that I treat, the restless leg syndrome disappears immediately. And it's the only real treatable cause of restless legs.
Mhm.
So again, heaviness, fatigue, restless legs, itching, burning, cramping, all of those things can be related to venous insufficiency. And
Wow.
so it is not simply cosmetic. Now, the spider veins are cosmetic, but any of the varicose veins are definitely not cosmetic, because it is a chronic progressive condition that can permanently damage the tissues of just beneath the skin and the skin itself. So you do want to treat it, and the earlier the better, to stop that progression of disease. Because once patients have ulcers, which is the ultimate end of the end result of venous insufficiency, their skin is permanently damaged, and we certainly want to prevent that from happening.
Um, so what does that look like on the skin? I mean, I'm in the dermatology side, so I see we deal with the skin and the appearance
Hmm.
and what people are looking at. How does that affect patients when they're looking at their skin? Is that something that they're more concerned about? Or obviously we want to fix the internal issues as well, but
Right.
what does that look like?
Well, the visible portion on the skin is those bumpy veins, those
Hmm.
raised bumpy veins. But many patients have varicose veins that aren't raised and bumpy. So it's really more about focusing on the symptoms. And if people have those symptoms, then that qualifies them for doing a diagnostic ultrasound. That would allow us to see the veins beneath the skin, and we would test them with the patients in a standing position, because you do need gravity to be able to test accurately. And so any of those symptoms would qualify patients to have that ultrasound, and that would allow us to determine whether those veins are functioning properly or not. So it's not necessarily something they would see on their skin unless they have those bumpy, bulgy veins. Now, at the end stages, certainly ulcers, that is something that they would see on their skin, or that when their legs become fibrotic and narrowed and discolored,
Hmm.
particularly in their calves. Patients are still treatable once they've gotten to that stage. And non-healing ulcers, those are certainly patients that can seek and should seek venous treatment.
So do you collaborate then with other physicians?
We do. We
Okay.
try. We try. It's hard to break into that, but yes,
Mm,
we definitely reach out to physicians. We have reached out to wound care clinics,
mm.
and they often have a pre-existing relationship that's hard to break into. So a lot of those patients get sent to the hospitals, but I don't believe that the hospitals are truly following through with accurate treatment, accurate and effective treatment.
Yeah. So then I would say, I guess if a patient sees these veins and they're like, okay, well, maybe I should just go to a vein clinic to get treated for this. And then you might end up finding another condition that they have because of those veins.
That's right. That's right, for sure.
Wow.
Yes.
That's
So
pretty
if we can
wild.
get, I think most of our patients do come from self-referral. They see our website after doing a Google search, and I think they start to understand that their symptoms would be related to venous disease, or they have family members or friends who have had venous treatment.
Mm.
And then there is certainly a percentage that comes from physician referrals. It's less than 50%.
When you treat it, does that kind of treat the whole condition or do you end up having to refer them out as well?
No, it treats the whole condition.
Yeah.
No,
Wow.
there are few things that we can't take care of in our
Yeah.
office. Very few. And I
Wow.
can't say that I've turned anybody away yet.
Yeah.
Yeah.
That's good.
So
That's
so we
good.
have the ability to make a true difference.
Yes. What is the biggest myth that people believe about visible veins on their face or their body?
Well, what you said earlier is that it's just cosmetic. It is
Hmm.
absolutely not cosmetic. There is a medical necessity to receive these treatments, because, as I said before, the progression of disease will ultimately end up with permanent skin damage,
Hmm.
and you definitely want to avoid that. So seeking help earlier is better.
Yeah. Okay. So tell me a little bit about like what spider veins are, if you can explain that for any of our listeners that don't quite understand what the difference between spider veins or varicose veins.
Well, spider veins are the red or purple veins that you can see on the skin surface, and they can occur independently, or they can also occur related to underlying venous insufficiency.
Mm.
So when patients come to our office with the idea of getting their spider veins treated, we always ask them questions about symptoms that they may have related to venous insufficiency. It's important to treat that venous insufficiency first before addressing the spider veins. If you treat the spider veins without treating the underlying venous insufficiency, it's going to waste their money and their time, because those spider veins won't truly shut down if you have underlying venous hypertension. So we can do both at the same time. We can come up with a treatment plan for their venous insufficiency, and during that actual treatment, also address their spider veins at the same time, which is more
So
efficient for them.
yeah. So, what does that kind of treatment look like? You had mentioned ultrasound as well, but are there lasers that you do? How do you actually treat the veins?
So at our office, we use something called radiofrequency ablation, which is an alternative to laser. It's newer technology. It's less hot because
Mm.
that is the way that you treat the veins is that you heat up the tissue, the lining of the veins, and that helps to seal those veins closed. So it's not as hot as a laser, and I think that patients recover more quickly using the radiofrequency ablation. But they both, in general, use heat to treat
Mm.
the veins and help them close down. And then we also use something called varicose, which is a type of foam sclerotherapy that is specifically been studied for the treatment of truncal varicose veins. And then we complement that with something called foam sclerotherapy, which I use to treat the tributary veins, which would be those veins, those bumpy veins that you see on the skin surface. And as I mentioned before, many of those bumpy veins are deep to the skin surface, and patients don't even know that they're there, but
Mm.
they need to be treated as well.
Like, okay, you say you close off the veins. So then what happens? I mean, those veins have what blood flowing through them, right?
Right,
So then
right.
what happens with that?
So over time, you will decrease your total blood volume because you have more than you need because you've got that blood pooling in those dilated veins. So that is one thing that occurs. And then the blood does get shunted to veins that do work properly.
Mm.
So we are treating superficial veins, which take care of about 10% of the blood return from the legs to the heart. The deep venous system does about 90% of that work. So that is the dominant system, and that blood will get shunted primarily to the deep venous system.
Oh,
And
wow.
then over your time, your body does make more superficial veins,
Hmm.
but generally most of that blood gets shunted to the deep system to take over.
Yeah. So do you do different treatments for veins in the face versus on the body?
So facial veins, we do use a laser because those veins are like spider veins in the face.
Mm.
And we never inject veins in the face, but we do use the laser and it is extremely effective. That is something that you do over time. It takes about 3 treatments. It's a series to
Mm.
really take care of those veins in the face or the nose. But yeah, it's very effective and it's amazing to watch it happen instantly,
Yeah. Wow. That is cool. I was going to ask, that was my next question was the time. How long does it take? Is it something that, because everybody wants, you know,
immediacy. Yeah.
immediate
Yeah.
reaction.
Yeah.
Yes.
So you'll see the veins respond immediately, but they
Mhm.
don't necessarily disappear immediately. As I said, it does take usually a series of 3 treatments.
Mhm.
Sometimes it's a little bit less. Sometimes it requires a little bit more. Everybody's different, and so you just see them monthly until those veins are gone.
Yeah. What does the post-treatment look like for patients?
For the legs or the
Yeah.
face,
For any treatment, is there
face is
anything
pretty much
particular?
nothing.
Hmm.
The legs, it's a little bit more involved.
Mm.
So they have to wear compression stockings for a time, beginning from the first day of their procedure until about 3 days after their last procedure. They do have to reduce their activities a bit, but we want them walking every day. We see them back for follow ups at 2 weeks after their treatments, 1 month after their treatments, and then a final follow up at 6 months.
That's so interesting, though. I mean, because essentially it's kind of relocating like the flow of blood through your
Yes,
body.
yes, redirecting it.
Yeah.
Yes,
Okay.
absolutely.
That makes
Because
sense.
those veins that are diseased are working against you. So what
Hmm.
happens inside those veins are one-way valves that get the
Hmm.
blood from your feet back to your heart. And then the way that that happens is you need to squeeze the muscles in your legs, specifically the calf muscle, and we call it a calf pump. So when you squeeze that calf muscle, you are squeezing the veins and you're pushing that blood back to your heart. Then when you rest, those valves inside the veins close and the blood just sits there and waits for you to start moving again.
Mm.
If for some reason those valves do not close completely, then some of the blood that you just pushed towards your heart will go back down towards your feet. And so you get an increased pressure in those veins and an increase in size in those veins. And that's what ultimately you start that pressure inside those veins does get transmitted to the tissues around it and it leaks fluid into those tissues, which is where the swelling comes from. And then ultimately you can get a change in your tissue structure that makes it more fibrotic and less healthy, with less oxygenation. So when you get a wound, it doesn't heal very quickly or very easily, and sometimes doesn't heal at all.
So I have a question for you. And I think about, the blood not circulating in your body properly. And immediately I'm thinking, okay, what about people that are sitting a lot, that
Hmm.
have jobs where they are not really up and moving around? Is there a
Yes,
higher risk for issues with these veins or, blood
yes.
clots and things like that?
Yes, there is a higher risk, both those patients and the patients that stand all day.
Mm,
So, what I try to talk to patients about is again using that calf pump. So, if they're a hairdresser or if they're a nurse, when they're standing, if they can try to flex that ankle and use that calf pump to try to empty those veins. And then for people who are sitting all day, one of the things I recommend is a device that is a platform for your feet with wheels on the side. So you put your feet on that platform, and that encourages you to flex your ankles back and forth. And so
mhm.
that flexion of your ankles is what's causing the contraction of the muscles in your calves. So that's one of the best things they can do to help keep their veins healthy and getting up and walking around every hour.
Yeah, that makes
Um,
sense.
right. You're absolutely right. People like that in those occupations are more prone to have venous insufficiency.
Hmm. Wow, that's pretty interesting. So, do people come to, I guess, for preventative care to see what do I need to do so I don't have to deal with these veins, especially if they see it in, families, members, and I don't know if that would be like a family history of something that would be
Yes, it
passed
definitely
down.
runs in families.
Oh,
Yes.
okay.
So you really can't qualify for an ultrasound unless you have symptoms.
Hmm.
So we are happy to speak to people about what they can do to prevent disease, but you can't really scan them until they have symptoms or they have visible evidence of varicose veins
Yeah.
if you want to run it through insurance. If
Okay.
you want to just know, then we can certainly scan you with self pay. But
Hmm.
there are restrictions on how much imaging I can do and run it through insurance. But certainly, like I said, we would be happy to talk to patients about who are concerned with family members that have terrible venous disease. We can give them those kind of tips to help prevent disease occurring in them. And certainly, compression stockings help too. If
Yeah.
you're on your feet all day, compression stockings are extremely helpful. They're not fun to wear, but they do help. They
Yeah.
do help prevent disease progression. Yes.
I just had a family member request some compression stockings for Christmas.
Yeah. Yeah. Even knee highs are helpful. So
Yeah, which I
I
was
would
looking
promote
at.
that for sure.
Yeah, I was looking at a couple different companies and I was like, oh, this one sounds interesting. But,
Mhm.
they were showing how some are not as restricting and a little bit more comfortable and could be
Mhm.
flexible. So, yeah, it was really interesting. That's funny that I was looking at that earlier this week.
I would
So,
definitely get that for your family member
yeah,
because it is helpful.
yeah.
After having their veins treated, we encourage them
Hmm.
to continue wearing compression stockings, at least knee highs,
Hmm.
whenever it's fashionably suitable. It's a
Yeah,
good thing to wear. And I wear them every day to work.
yeah,
My clothing is definitely much more relaxed, so I can
yeah.
get by with it. But when patients can do that, I encourage them to do so,
Hmm. I've
at
heard of
least in the
wearing them.
wintertime.
Yeah, I've heard of wearing them like when you're flying and stuff. I heard that's really
Yes,
good.
absolutely. Getting up and walking around for sure.
Hmm.
And if you
Yeah,
can't walk around, use that calf pump and wear the compression stockings. Absolutely.
yeah. So, how uncomfortable is a treatment?
It's a great question. It really is patient dependent.
Hmm.
There is a huge spectrum. Some patients don't blink an eye, and I've had a handful of patients that are really uncomfortable. The good thing is most patients tolerate it really well. The other good thing is that we do offer nitrous, which
Hmm.
has been a huge improvement in our ability to help people be comfortable. There are
Wait,
needle
like
sticks.
laughing gas?
Yes,
Oh.
yes. And the good thing about laughing gas, it's so safe. It acts
Hmm.
quickly, it's gone quickly, so you can drive yourself to and from the procedures. It's made a huge difference for us because I feel terrible when patients are uncomfortable. Anything that I can do to help them be more comfortable is something that we want to be able to offer. So there are needle sticks because I have to give you numbing medicine,
Hmm.
and we do have to numb all the way around the vein that we're using heat. So that's the biggest issue. And the foam does cause a little bit of burning.
Mm.
So it's all about what the patient's level of pain tolerance is and how anxious they are about the procedures.
Hmm.
But I have never had anybody not follow through, and the nitrous has made a huge improvement in our ability to keep people comfortable.
Yeah.
And we talk to them. We've got music going on, the TV's there, so there are distractions. We've got squeeze balls. We have little tools to help them be as comfortable as possible.
Yeah.
But most patients do quite well with it, and it's not too burdensome.
And do they have to plan for any downtime or anything after a treatment?
Just exercise, but we
Oh,
want patients going back to work.
okay.
Absolutely. Otherwise, going about their normal routine, we want
Yeah.
to increase their walking daily and we have to reduce their exercise of all types
Oh, wow.
for 2 weeks. Yeah.
Okay.
Yeah.
That's good. What is something that patients worry about the most with vein treatments that end up not really even being an issue?
I would say just the fear of the unknown.
Mm-hmm.
Once you get them through the first procedure, they're pretty chill after
Yeah.
that. But they just don't know what to expect. You can
Yeah.
talk to people about it, but it's just until you actually experience it and feel it, that unknown is scary.
Yeah. Yeah, definitely.
We're there
Yeah.
for them. We see them from beginning to end. And my staff is amazing. And just talking to patients and distracting them and helping prep them and helping them understand as they, get closer to the procedure day or even, certainly on the procedure day, just talking them through it. And we get them where they need to be because it's so important to actually get the treatments done that
Mhm.
we want to do everything that we can to make it as comfortable as possible.
Yeah,
So.
kind of put their mind at ease a little bit.
Absolutely. And yeah, getting through the first one is the hardest step. So,
Yeah. Now, a message from Sun Pharmaceuticals. For patients with locally advanced basal cell carcinoma who are not candidates for further surgery or radiation, hedgehog pathway inhibitors offer a targeted systemic approach. Staying current on these therapies can help you expand options for appropriate patients. How does that kind of fall into the whole wellness side of your company, and what other support are you guys offering to any of your clients?
well, I think people who are looking to have an improved quality of life with their legs are
Mhm.
also open to improving the quality of life elsewhere. So, the wellness is our top priority is bioidentical hormone optimization. So our bodies are exposed to endocrine disruptors and our hormone levels are not what they really should be. And so we are here to help patients feel better through giving them the bioidentical hormones, and that also helps them live a healthier, more productive life. The hormone optimization decreases all cause mortality.
Mhm.
Specifically, it reduces your risk of heart attacks, strokes, and heart failure. It reduces your risk of dementia and Alzheimer's. It reduces your risk of cancer, specifically colon cancer, lung cancer, breast cancer, and prostate cancer in men. It reverses or prevents osteoporosis. And there are no drugs out there that will do those things for you. And so, if we can optimize those hormones, we will help people to prevent disease. And those are all the big killers, the ones that I just listed. And it helps you feel better. It
Mhm.
helps with sleep, it helps with libido, metabolism, energy, brain fog, joint pain, night sweats, hot flashes. Those are all the things that you will notice, but you also, in the background, you're helping your body be healthier so that you
Mhm.
can prevent disease and not treat disease.
Yeah, that's wild that all of that is related to your hormones.
That's right. And the ones that we offer are bioidentical, which means they are
Mhm.
exactly the hormone that your body makes. They are derived from nature and they are delivered in your subcutaneous fat.
Mhm.
So below the belt for women, above the belt for men, because that's where we each have a little more fluff. And
Mhm.
then that hormone gets slowly delivered into your bloodstream, which is how your body would deliver it. And then that level is maintained over time. And then at the end of the pellet's life, you slowly decrease that hormone level. And the idea is to repellet at that time so that you can maintain the level that helps you feel your best.
So repellent, what does that mean? Is that like
So
an injectable for one treatment, or how often is this?
So pellets are how the hormones are delivered. They're like little
Mhm.
pills that go into your sub-Q fat, and that's how testosterone and estrogen are delivered. And then progesterone is taken orally, typically at night, because it really helps you sleep through the night.
Mhm.
And for women, it's typically every 3 to 4 months, and for men, it's every 4 to 5 months.
Oh, wow.
As
Mhm.
opposed to patches or injectables or creams,
Mhm.
which just aren't as reliable. Those levels aren't as reliable. And I think the pellet, it just gives you that consistent hormone level that makes you feel your best.
Yeah. Wow. I did not realize that was how that worked.
Right. So, yes. And so women start losing testosterone in their 30s,
Mhm.
progesterone in their 40s, and estrogen in their 50s. And then men are just Most are low testosterone levels. Most of them have. And it's all related to our environment. We have so many products that we're exposed to, whether it's plastics or perfumes or types of foods that we're eating, the processed foods. All of these things around us are actually messing with our normal hormone levels, and our bodies are not getting those hormone levels where they need to be and where they should be. But it's because of the things that we're exposed to that we don't even know we're exposed to.
Yeah.
Styrofoam, you know, cooking things in plastics in the microwave. I mean,
Mm.
you're just adding all of these endocrine disruptors to the food that you're eating.
That is
So we're
wild.
just, yeah,
Yeah.
we're trying to get people to kind of shift how they think about what they ingest and trying to use glass and stainless steel as opposed to plastic water bottles or plastic
Mm.
dishes. We're just trying to help people realize that it's not something that's innate. You wouldn't understand that these chemicals are leaching into your food. And so
Mm-mm.
it's harming our normal hormone levels and making us less healthy.
Yeah.
So we want to try to rebalance those hormones and get them to the levels that they should be.
Yeah, I think that is it's a huge thing right now where so many people are actually looking into it, and I feel like that is something that it's being more widely talked about is what you're putting into your body and how it does disrupt your hormones because I don't think we ever really thought about that. I mean, growing up,
We
I
didn't.
that was
I mean, we've
never a
always used
question.
plastic. We've never thought
Hmm.
about that kind of stuff, but it's real. I mean, I
Yeah.
test for that stuff every day. It just blows your mind. And
Wow.
this is why I got into medicine, was to help
Hmm.
people be healthier. And if I could shout it from the rooftops, I would, because this has been the most rewarding thing that I've added to my practice.
Hmm.
It's just we test patients in our office, we draw the labs in our office, and we can identify things that their body is missing. Many of it's vitamins and minerals, and of course the hormones, but we can help give those molecules back to the patient's bodies naturally. And
Hmm.
the supplements that we used are as pure as you can get. And so our nutrition is definitely not what it should be as well.
Hmm.
And all of this processed food, it's not nutritional. It's not giving patients the vitamins and minerals that their body needs. And so I do the labs to identify what's lacking and try to replenish that. I mean, one of the biggest things here in Ohio is vitamin D levels are low in everybody that I'm testing. And I
Yeah.
don't know if you remember, but one of the causes of a poor outcome with COVID was low vitamin D, because
Hmm.
vitamin D is essential to have a normal immune system.
Yeah.
So that's one of the things that we're helping most patients with because they need it
Yeah,
to
I
be
think
healthy.
that was one of the vitamins. Like, if my daughter was getting sick or something like that, I'm like, all right, let's
Hmm.
ramp up your vitamin
That's
D.
right. D and C, zinc and quercetin. Yes.
Yeah.
So
Okay.
there's a little cocktail.
Right. So you do those labs in your
Yes.
office. That's really
Yes,
interesting.
we do.
So I feel like that was always something that I was looking for to find, and I never knew, like, you know, how do I figure out that? How do I
Well, come to
know
the
what to
office and we'll
ask
take care
for?
of you.
So
Yeah.
that's cool.
Yes.
So it tests all of those different levels, the hormone
Yes.
levels, your vitamin, your deficiencies, and all of that, and then you
Yes.
can basically say, okay, this is what your body needs.
That's right. Yes. We
Wow.
can get them on the path. We also do a lot of probiotics and fiber because your gut is like an endocrine organ, and your gut is essential for nutrition, for optimizing your immune system and reducing inflammation. And
Hmm.
inflammation is so damaging, and so many people are afflicted with that. So we're encouraging gut health as well. And we do weight management. That is a big factor for metabolic syndrome and overall cardiovascular disease, joint disease, back
Hmm.
disease. And so we're just trying to help people get to their best self.
Yeah. I know. I think that's something now, more people are wanting to figure out, okay, what is the underlying issue? You go to urgent care and they fix whatever issue is at the moment
Right.
versus looking into everything deeper and figuring out, okay, this is why you're having this
That's
fatigue
right.
or, what those
That's
issues
right.
are. So I love
And,
that.
and changes in lifestyle.
Hmm.
Trying to get rid of the foods that you eat that are not healthy. Looking at
Right.
the labels. If there aren't whole foods on those labels, you need to put it back on the shelf.
Yes.
Yeah,
That's
because
hard.
that synthetic food is harming
Hmm.
people. It is causing them to be addicted to food, and that
Yeah.
is not what we need. And addiction to the kind of food that they're making is just it's harming our bodies and it's disrupting how our bodies manage glucose.
Yeah. Yeah, it's so crazy. I can't remember, it was like maybe a few years ago when I was probably doing some random diet that I read. And one thing that really stuck with me though is like when you're at the grocery store, you should be basically shopping on the perimeter, where your fresh foods and your produce
Yes,
and
you're
everything
absolutely right.
versus
Whole Foods. Yep.
yeah, the
Yep.
internal aisles. But
Yeah. The
now like
packaged stuff is scary. You got to really look
yes.
at it.
But I do. I look at everything now. And I'm like, nope, I can't read any of
Yep.
these ingredients.
Nope.
I don't want
Can't
that.
pronounce it. Put it back on the shelf.
Yeah, but it makes me so frustrated though, because now it's like the things that I had when I was younger, like
Right.
I don't want to eat that, and then
Nope.
you're worried about the dyes that are in our stuff, it's just,
Absolutely.
it's so wild.
And what our children are exposed to.
Hmm.
And then children have behavior disorders or they're diagnosed with
Right.
ADHD, and much of it is related to the food that they're eating or the soda that they're drinking.
Yeah.
And if you can just cut that stuff out, you won't need a medication or you won't feel like
Hmm.
you need a medication
Yeah.
to rein in how your child's behaving.
Yeah. I
They
know. And
just need good whole foods
yes.
and not fast food and not
Right.
processed food.
Yeah,
So,
I know. It can send you down a rabbit hole for sure. Cause then
yeah,
I'm
it sure
like,
could.
okay, what is the school offering? What is the
Hmm.
lunches? And like, all
Yeah,
right, now who do I need to talk to figure out how to fix these the lunch
that's right.
program?
Yes, I agree.
Way too many
We
things
need
on the list to
Department
do.
of Education needs to work on that.
Right. So, what is one of the most unexpected things that you've learned during your career about veins or your company, your business in general? What is the most unexpected thing that you've learned?
Oh, that's a hard question. I don't know about unexpected. I think the value of your personnel can't be
Mm,
overrated. I have been blessed with a group of people, women, who truly care about the people that walk through our door.
mhm.
And when I started this, I didn't recognize how critical that was, but it absolutely is. We help patients feel comfortable. Patients know that we are listening to everything that they're saying, and we're there to do our best for them one at a time. And having the right people that truly have their heart into the business is critical. As I said, I have been blessed with a wonderful group of people, and I think we're going to hopefully continue to grow. But that to me is one of the most important parts of having your own business. And
Yeah.
luckily, I get to make those decisions. So,
Yes.
so when I worked for someone else, I didn't. I couldn't make those
Hmm.
decisions, and I couldn't do things the way that I thought was best. And now I can, and that's a good feeling. And as far as unexpected, I would say the wellness has probably been the most unexpected gift that I can help give to others, and educating them and helping them recognize the things that are in life that aren't helping them but are harming them.
Right.
And, I was part of the medical system. I didn't understand how much harm pharmaceuticals could do. And I have come to that realization and trying to help patients improve their own health and get off of those pharmaceuticals. That's probably the most unexpected thing that I've encountered in this journey, and is something that I am wholeheartedly about, is helping patients live a healthier, longer life and be
Yeah.
happier and feel better about it all.
That's good. I love that. So, what's next? What is on the horizon for your company? Anything new coming up?
Well, as a matter of fact, we are sitting in our new office. It opens officially on January 12th. We were fortunate enough to be able to design the office ourselves. And so I think it's going to be wonderful for growth and inviting patients in. And I think they're going to feel good in this new environment. And our office is going to run more efficiently and effectively. And I think it's just going to be more welcoming. We're in a more vibrant area of town, and I think hopefully patients will just stumble upon us and or search us out and take part in what we're celebrating here and what we're growing to be.
Yeah, that's exciting. So, anyone in the Columbus area, if they're listening and want to find you, what is the website and how can they schedule an appointment?
So it's Acrobus Veins and Vitality, and it is all spelled out. I think
Okay.
our old name was Polaris Vein Center, and they are going to be linked.
Okay. And we
So,
can put that in the show notes as well. So, we'll have
okay,
that available
okay,
for anyone.
okay.
So, thank you so much, Dr. Cooper. It was such a
Thank you.
pleasure talking to you and learning a lot. This is
Yes,
really
it's
good.
it's amazing how few people put their symptoms together with true vein disease, and it's easy to get evaluated and diagnosed, and then we come up with a treatment plan on the day that you have your ultrasound, so we can get you moving through pretty quickly. So it's something that does need to be addressed, and I encourage anybody who's hearing this to seek treatment, and we will do our absolute best for every patient that walks through the door.
Yeah, that's awesome. Thank you so much. Now a message from Sun Pharmaceuticals. For patients with locally advanced basal cell carcinoma who are not candidates for further surgery or radiation, hedgehog pathway inhibitors offer a targeted systemic approach. Staying current on these therapies can help you expand options for appropriate patients. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.